Hello, it's Alan. So, welcome to my top surgery tips video. I've put together a little list of tips for people who are heading into top surgery, because I enjoy helping people. So, I had top surgery a month ago with Dr. Crane and Dr. Satterwhite in the San Francisco Bay Area. So here are my tips. I'll start with stuff that is in the preparation phase, like before you have surgery. So, one helpful thing that I heard from somebody else on YouTube, I believe, is to have on hand a number of, like, kind of loose button-up shirts that you can wear, like, in the week or maybe 2 weeks after surgery, because you're gonna have this binder on with a ton of bandages, which is thick, so it's not really gonna work, or it's not gonna be comfortable to wear shirts that are tight. So if you don't have loose button-up shirts already, you can go get some, like from a thrift shop, a secondhand shop. That can be good because not only can you get ones that are looser than you might wear otherwise, but also you can get just kind of crappy old shirts that you don't care if they get dirty, because while I myself did not have any kind of bleeding or anything like that came out of the bandages, some people do, so just in case it would be good to have shirts that can get blood and stuff on them. Plus, you know, if you're drugged and like laying on the couch watching TV, eating stuff after surgery, you might spill on yourself, so yeah. And then shirts that button in the front are good because then you don't have to deal with raising up your arms to put a shirt over your head, because you're not going to be able to raise your arms up. And another preparation thing is, let's see, have on hand or bring with you to the place where you're getting surgery. Like if you're going to stay in a hotel, bring with you something like a soft cloth, a soft rag, or a bandana, because what I had to do, or my situation, was that this binder that I had on after the surgery had rough edges, and it was so tight it was like digging in here so hard, and I was getting like raw from the chafing, especially at one part. So my mom tucked a bandana into the edge of the binder, so then my arm would rub against that instead of the horrible rough binder. So if you tuck soft cloths into your binder in various places, that can make a huge difference. And another preparation thing you can do is before your surgery, move stuff within reach. So like, if your socks or something are normally like this high, move them down on the floor or to some sort of a lower place where you can reach that, like clothes, food. I mean, hopefully you'd have somebody there helping you and giving you food, but just in case, move some stuff lower. Toiletry stuff, bathroom stuff, move it, you know, to like this type of a height. And what else? Another clothing item that you might want to plan to bring with you, or at least to have, is shorts or pants that are very loose, particularly with a kind of loose waistband, an elastic waistband that's loose. I say this because I had like gym shorts with me, so the reason why shorts or pants with a normal, like, sort of tight waistband is not good is that after surgery, like, if you're trying to pull your pants down to change your clothes or to go to the bathroom, obviously if the waistband is tighter, that takes more force. And yeah, after surgery for several days, it was really hard to pull my pants down and up. I could have had somebody help me if it was bad enough. I was able to do it. Um, I I would have asked my mom if I thought I was going to damage myself, which I don't think I did. But anyway, it's just much better if you have really loose shorts or pants with a loose waistband. Okay. So, I guess a couple other things you could plan to have with you or to bring, like if you're going to be in a hotel, is, well, washcloths. They have that at hotels, but you might want a couple more because, um, like, I was not able to wash my own face for a couple days after surgery because just any kind of movement, like bending or like moving my arms, was too uncomfortable. So, if you have a washcloth, then the person who's taking care of you can get soap on the washcloth and wash your face for you. And then it's good to have multiple washcloths because if the anesthesia makes you barf during the 24 hours after surgery like I did, washcloths are good. And along those lines, it can be good to bring wet wipes, like this kind of thing, because that makes washing easier. It's good for washing your hands, because it's just that much easier. Or, like, you could even, like, wash your neck or whatever else you want to do. Or, you know, if you throw up, the wipes can be good. So, let's see, what do I have yet to cover? Another thing to have on hand is straws for drinking, because it was too uncomfortable to hold a glass like this and lift it up for the first couple of days, so it's just better if you can drink from a straw. And a couple of drug notes. So it's, if you're not allergic to it or anything, it's good to have something like Benadryl, because Benadryl makes you drowsy, and then you can have an easier time sleeping, because sleeping, for some people, like me, might be a little hard because you're just so uncomfortable after the surgery. So Benadryl can help with that, and then some people say they have itching, either because of the painkillers or because the binder and the bandages itch, so Benadryl can help with that for some people. And, well, I don't know if this applies to anybody besides me, but, on the day after my surgery, my mom drove me from the surgery place, like, 4 hours to where my mom lives. And I get motion sickness really easily, plus I was a little nauseous from the just pain medication or recovering from the anesthesia, so the travel sickness medicine helped with all that. So if you feel like any of that applies to you, bring along some travel sickness medicine like Dramamine, which I don't like. I recommend Bonine much more highly. It's spelled Bonine. And, I mean, check with your doctor, of course, before you take any drugs that they haven't prescribed. I was told that I could take Bonine, but you need to check before you take anything. Speaking of the car ride, I suggest that you avoid any lengthy car ride or traveling on the day of surgery. 'Cause before I got surgery, I was like, oh yeah, I can do the ride, the 4-hour ride to my mom's house on the day of surgery. I mean, what's so hard about a car ride? You just sit there. But we ended up staying in a hotel the night after surgery, so immediately after my surgery, my mom drove me the, like, 5 minutes to our hotel. That was highly unpleasant. That was uncomfortable. I do not recommend any significant drive on the day of your surgery, because it's like, first of all, I felt nauseous. You don't want to be nauseous when you're in a car. I just felt cranky and just crappy. You don't want to be in a car ride if you feel crappy. And, like, my chest felt so raw and uncomfortable that any movement was hard. Like, when she drove around turns, just normal turns, that was not good. It was not good on the second day either, but it was actually significantly better. And with the painkillers and the travel sickness medicine, I I had a fine time in the car ride on the day after surgery. Other people might find that too hard, but yeah, so that's my advice about that. And oh yeah, somebody asked me about driving. So the doctor's office told me that I could drive as soon as I felt able, as long as I was not on pain medication, because driving on the narcotic pain medication is like driving drunk, which no one should do. Um, but even though I stopped taking the pain medication within like 6 days after surgery, I did not even attempt driving until 2 weeks after surgery. Um, I think I might have been able to drive 1 week after surgery, but I think that would have been really uncomfortable and kind of painful, and I'm not sure how safely I could have driven, because even when I first drove, which was 2 weeks after surgery, it was uncomfortable, and I had to, like, do turns by, like, going like this to turn the steering wheel instead of reaching up and around, so that's not the best situation. So, I highly recommend that you do not plan on driving your own car, like driving you yourself, within the first few days after surgery. Like, really try to wait at least a week if you can before you drive yourself. That reminds me also about going back to work. So, I mean, I don't have a physical job, thankfully. If you have a physical job, I mean, I would say give it a good 2 weeks. 3 would be more ideal. But for a job like mine, where what I have to do is sit and use my brain and, like, write and stuff, because I'm a teacher, so I was for sure able to go back to, like, planning my classes for school within 1 week. Pretty much as soon as I was off of the pain medication, I was able to do my school planning. I did not have to go back to the classroom, though, until 3 weeks after surgery, and that worked out just fine. That was totally fine. I could have gone back to the classroom, like, maybe 2 weeks after, 2.5 weeks. So, there's that. And then a couple other tips. So, it's helpful to have somebody that you can be in touch with after surgery who has gone through the experience. I didn't expect that, because I thought, I've watched a lot of videos on YouTube about top surgery. Like, I've had shoulder surgery before. I didn't think I would have that many questions. But I actually had a lot of questions, where in the couple of days or the week after surgery, I was like, oh my god, I need to text my friend and ask all these questions. And I was, like, freaking out, like, is this normal? Is this other thing normal? Did you experience this? What did you do in this situation? Sometimes they're just questions you want to ask that are not necessarily doctor questions. They're just about the experience. So, like, see if you can be in touch with somebody who's already gone through top surgery. And, about the surgery or the results itself, well, I mean, I already made a separate video about my surgery experience, which you can go look at. But something I'll mention here that you should have in mind is that you should prepare yourself mentally, or, expect for the nipple grafts to be raw. I hadn't really quite thought about that a whole lot, but, like, there's a reason why you have to wear gauze over the nipples for at least 2 weeks, maybe 3 weeks, which is how it is for me. You have to wear gauze over them because they're raw. It's gross, and it's really disconcerting. Like, it caused me some anxiety. I was like, that seems bad. Is it supposed to be like that? Like, are the grafts falling off? But my impression is that, or, well, I asked the doctors, I showed them pictures, and I asked, and they were like, that's normal, that's okay. They're gonna be just like, as if there is no skin there for a long time. You know, like maybe 2 weeks before you start to notice much difference, potentially. So just be expecting that. So I think those are all the tips that I could think of. Let me know if you have any more questions. Thanks for watching. Bye.